Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Causes and treatment of congenital hearing loss. Congenital hearing loss means you are born with partial or complete hearing loss. It is most often associated with genetic disorders that affect the normal development of hearing organs, although birth complications, maternal infections, and drug and alcohol use during pregnancy are sometimes to blame. /r/n/r/n hearing loss is a common condition in many children, and testing for early detection of hearing loss is a standard part of postnatal care. The treatment can vary by the cause but may include hearing aids, cochlear implants, or sign language. /r/n/r/n This article discusses the symptoms and causes of congenital hearing loss, including what can be done to diagnose and treat hearing problems in children. /r/n/r/n/Verywell, Julie Bangrnrn/r/n/r/n Congenital hearing loss is categorized by how sound transmission is affected. There are three types that can occur congenitally. /r/n/r/n Symptoms of congenital hearing loss vary by age. In newborns, symptoms are difficult to notice, which is why postnatal hearing screening tests are so important. /r/n/r/n Symptoms of hearing loss in infants and babies include /r/n/r/n Symptoms in older children can include /r/n/r/n The most common cause of congenital hearing loss is genetic. Genes play a role in the formation of the hearing organs as well as the nerve pathways. /r/n/r/n More than 180 deafness genes have been identified. Some are nonsyndromic, only affecting hearing, while others are syndromic, involving hearing loss and other deficits, like blindness or intellectual disability. /r/n/r/n Genetic syndromes associated with congenital hearing loss include /r/n/r/n There are other common causes of congenital hearing loss that do not involve genetics, including /r/n/r/n Diagnosing congenital hearing loss in newborns requires specific tests. It is recommended that babies be screened within the first month of life. Most newborn babies born in hospitals are screened within a few days of birth. /r/n/r/n The screening test generally consists of these two non-invasive diagnostic tools. /r/n/r/n If these tests reveal hearing loss, the child will need additional testing in the future. Many of these tests will be behavioral-based, such as making a sound behind a child to check when or if they notice it. /r/n/r/n Screening may also involve genetic testing for congenital syndromes and imaging tests of the inner ear and brain using magnetic resonance imaging, MRI. /r/n/r/n Treatment for congenital hearing loss is multifaceted and involves a team of healthcare providers, which may consist of /r/n/r/n Since there is no cure for congenital hearing loss, the treatment is focused on improving symptoms and preventing further hearing loss. These may include the following to prevent delays in speech and language development. /r/n/r/n Congenital hearing loss is a form of hearing loss present at birth. It may be caused by genetics, birth complications, maternal infection, and other conditions. /r/n/r/n While there is no cure for congenital hearing loss, early detection and treatment can prevent speech and language delays. Treatments involving hearing aids and sign language can help children adapt and develop at the same pace as children without hearing loss. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.